There it is. Hello, hello. I will wait on here for just a little bit longer. Hello. Let's see. Okay, so I can see if there are any comments. And then I'll trim all this off when I post the actual video. So, welcome back. I'm Jen. I am the owner and founder of Missouri Pelvic Health, and this is, I think, the third video we're doing now with like a little lunch and learn sort of short video just over some different pelvic health topics. This one might be a little bit longer than 5 minutes. I have my notes, so hopefully I stay on task. But if you see me look down, that's what that's for. So today's video is going to be on the intimacy topic. So I know a lot of people know me personally. Don't worry, I'm not talking about me. I'm not talking about anything personal. There's not going to be anything graphic, anything like that, because I don't want to get kicked off of Facebook. And it's purely from an educational standpoint, the stuff that we're going to talk about today. But that being said, if it weirds you out, Mom, to hear me even talk about this, then just go ahead and exit right on out of the video. So I did get some really good comments and messages just off of the information that was on the little 4 doodad thing that I posted yesterday. So I'm excited. Hopefully you guys learned some things, and then definitely, like always, shoot me a message if you've got specific questions, and then I'd be happy to answer those. So the first thing that was on there is the statistic that women take 3 times longer than men to have an orgasm during partnered intercourse. So there are a lot of reasons for that. The first is just anytime you have 2 people instead of 1, you've got the other person that you're also taking into consideration. So that alone is going to kind of slow the process down a little bit. But there's a physiological component and then a psychological component to how long, quote unquote, it takes somebody from the beginning of arousal to orgasm. And so physiologically, just men and women are hardwired differently. The analogy that works well is men are more like microwaves and women are more like ovens. They just need a lot more preheating, a lot more arousal beforehand in order to kind of get from start to finish. There's more of a psychological component to female arousal than there is male arousal, and I will dive into that a little bit more here in just a little bit. But if it was purely physical, like they would already have female Viagra by now. And because they don't really have that, that shows that there is a deep, deep, intimate emotional connection for women, a little bit more so than men, in order to kind of go from start to finish. So the second little bullet point that was on there was that 75 to 80% of women do not orgasm with vaginal penetration alone. This is where media sort of falsely has a narrative that you can just have vaginal penetration and it's going to lead to, happy ending for everybody in all of 10 seconds, which is not reality, and it's also not just how your anatomy is. So I did print off a picture of something, and then I'm also going to use the model for just a little more education. So when it comes to a female, let's see, this is, let me get it at the angle right. So this is top, bottom. So your tailbone's down here and then the pubic bone's up here. So we've got the vaginal opening right there. And then if you can see, gosh, this is all backwards. Right here is what's called the glands of the clitoris. So that is the part that sticks out just a little bit. And this is where all the nerve endings are. They are not inside. They are on the outside. And so that is equivalent to like the head of a man's penis, just as far as like how we're developed in utero. So this is really important to know that there is nothing wrong with you if you cannot orgasm just with vaginal penetration alone. We are designed to have more of it happen on the outside. So then this was the other picture that I had. In what I always have patients tell me is fascinating is how similar the anatomy is between a male and a female external genitalia. It just comes in a little bit of a different package. So, gosh, I don't know if I can do this backwards. So this is male, that is female. That actually is what the entire clitoris looks like. You just have the tip there and the tip there that sticks out. So when you put it in the whole package here, you can see that there's part of the organ that can be stimulated internally, but you are going to get way more bang for your buck on the outside. Okay? All right. The third bullet point was that low libido is rarely just straight hormonal. I feel like this sort of is the default that a lot of us think, especially as women get closer to menopause. They just tend to think that it's my hormones, and that's why I don't really have much of a sex drive right now. And that does play a role in it, testosterone and estrogen specifically, but it is not the biggest determining factor when it comes to libido. I cannot recommend this book enough. Okay, I recommend this especially to my patients who are coming to me for painful intercourse. It's called Come As You Are, and it's by Dr. Emily Nagoski. And she just spits facts, again, with the internet and media portraying what women think their sexuality is supposed to look like. And the truth is that the vast majority of what you see in TV and movies is not how it works in real life. And then women feel shame when they think that they are different than what they're seeing in TV. So she goes over something that has to do with arousal and sexuality being a series of accelerators and brakes. And it clicks for most people, and it really made sense to me that there's nothing wrong with you if you feel like every little thing kind of turns you off. That just may mean that you have a more sensitive brake, right? So your brakes are going to be things that turn you off, get you out of the mood, and kind of are a buzzkill. The accelerators are the things that would turn you on and that you would want more of to kind of move you closer towards your destination. And so if you think about in a car, right, if you are slamming on the gas pedal, but your emergency brake is on, you're not going anywhere. So arousal really is about figuring out how to press on the gas pedal, like what you like, and then to take your foot off of the brake. Push on the ons and then take off the offs. And there is a sort of a continuum of individuals who have either more sensitive brakes or more sensitive accelerators. And it's just good to know what you are so that you can set yourself up for success. And then when I'm done with this video, I will post in the comments a link to a questionnaire that Dr. Emily Nagoski has, specifically helping you to try to figure out about you, okay? What I do find fascinating though, and I'm going to share this really quick because I feel like it's worth noting, is, you know, she kind of breaks it down into how sensitive your brakes are, either low, medium, or high. High sensitivity to your brakes would mean everything turns you off. And more than 50% of women are right in the middle, okay? So the vast majority of them are not just like turned on by everything. And also the vast majority of people have like a medium sensitivity when it comes to brakes. Same thing along the how sensitive your accelerators are. Again, 70% of women fall in the category of medium sensitivity to accelerators. Only 8% of women have a really sensitive, like everything turns me on, I just have to look at somebody and, oh, I'm ready to go. That is way more of a movie and a TV thing than it is reality. But I also want to say that the big thing that necessarily doesn't or is not necessarily a determining factor in your libido is your blood alcohol level. So if you ever get the advice to just like have a glass of wine and that's going to fix everything, that is not only terrible advice, it's actually harmful, because that is not something that you should need to do in order to be intimate with your partner. If you do, then that's a whole different conversation. If you do tend to have more enjoyable experiences when you have had alcohol, that probably just means that you have some sensitivity to the brakes. And obviously, alcohol is just going to take that emergency brake right off, kind of release some inhibitions, and then allow you to move forward more with your accelerators. So, the very last bullet point was that intercourse should never, ever, ever be painful. There are a lot of reasons why you could have pain with intercourse. Some are definitely more medical in nature, and then others are, I would say most of the time, it's more of a musculoskeletal thing. And then that's when you would come see me or like a pelvic floor therapist. But some of the reasons why intercourse could be painful, but that are more medical, would be like an infection, right? So like a yeast infection, a sexually transmitted infection, anything like that can make intercourse painful. So that would want to be something you would want to tell your doctor about. Anytime you have bleeding after intercourse, like not on your period, that is a huge red flag, and you definitely want to let your medical provider know that, because there are just some things that they really need to screen for if you're having any bleeding with intercourse. Vaginal dryness can lead to a lot of discomfort during intercourse. That tends to happen the most around times of low estrogen, so postpartum, especially with breastfeeding, and then when you're starting to go through perimenopause and menopause. Your body just doesn't have the amount of estrogen in it that helps collagen kind of plump tissue and just naturally provide lubrication, so vaginal dryness is more significant around those times, in which case there is nothing wrong with using a lubrication. I will say, if you are in a low estrogen state, I tend to recommend more of the like silicone and oil based rather than water based. Water based will absorb and it gets kind of sticky. Silicone based, which would be like Uberlube, is the one that I typically recommend, or oil based, or even just coconut oil if you want to go more the natural route. Just know if you use oil based, you don't want to use latex condoms at the same time. Oil and latex, they will start to break each other down, and that kind of defeats the purpose of even using the condom if the lube is going to break it down. The thing that I see people most for with discomfort during intercourse is muscles, right? If you have just gotten like your flu shot and your muscle's really sore and somebody touches that muscle, it hurts. So the pelvic floor muscles are the same way. If those muscles are tense and then they get attempted to be stretched, like with vaginal penetration, or even just touched with like tight clothing, tight underwear, then they can cause some pain, and that's definitely something that a pelvic floor therapist can work on. Some things that would generate that extra muscle tension: scar tissue, recent physical trauma, so like labor and delivery, a surgery, any sort of sexual trauma, 1,000%. Our body's trying to protect you if you've had that in your past. And let me see. No, the model fell apart when I dropped it. But the muscle at the vaginal opening is round, and so if that muscle is tense, it's going to close off the opening. And so you're not going to have a pleasant experience when attempting initial penetration. So all the things that I work on with patients every day. I will say, if you have come to see me for therapy before, you know how important breathing is, like so important. We go over it day one. And so, foreshadowing to next week's Lunch and Learn, it's going to all be on the connections between your pelvic floor and your breath, and how you can use breathing properly to help with tons of things like bowel and bladder and intercourse and all the fun things. So if you learned something during this almost 15-minute video, sorry, but it's one of my favorite things to treat. If you learned something, please comment me in the video, just so that I know people are actually watching and that they're learning something and getting something out of it. If you have questions, definitely shoot them in the comments, or if you don't feel comfortable putting it in the public comments, shoot me a message on just on Facebook Messenger. But I guarantee you, if you have a question, somebody else has that question too. So I may copy and paste and put it in the comments and then answer it there so other people can also see the answer, but I won't put your name on it or anything. But all right, thank you for coming to my long talk. Next week's won't be as long just because there's not as many sort of subtopics, but I could give an entire hour-long lecture on just intimacy. And like I said, I really love helping women through this specific diagnosis because it is so multifaceted and there are so many things that we can try. And when you can make that better for somebody and give them that back, it's my favorite part. All right.